Now, my request, as we move away from here, we need to carry messages. These pre-eclampsia, don't worry if there are things that are complicated. We shall give you guidelines, we shall give you protocols, we can continue, we shall give you lectures, we shall continue. But I requested that we sign this board. We want to come back here next year to commemorate and count how many cases of preeclampsia death have we recorded in the region. Our target is 0. Our dear midwives, you are very critical, you are number one, you are the frontliners. You are all going to have an opportunity to come and sign here. We have been in facilities and we find the entire register. In the entire register, the BP is not recorded. Where it is recorded, like yesterday I was in a health center for, and me, after every public function I go to a health center for. I will not even tell you which one I'm visiting today. So, we found mothers identified with high blood pressure, 160/92. In the column for risk factors, nothing. Or there is a very good word called nil. We know you get tired. I know you get tired. I know you are overloaded. And we are working on that. There's a new structure that's coming up. But we want you to take these vital observations serious. The vital observations, record the blood pressure, but also interpretation. Interpretation of the vital observations. It may not be Masaka doing this, but when you go for mentorship, when you go in facility supervision, get interested in the column for blood pressure. Get interested in the column for gravidity. Get interested in the column for age. Get interested for a column for any infections this mother could be having. That should translate into the column of the risk this mother has in the pregnant. We want all mothers who have a risk to be linked to a high-risk clinic and they are managed or seen by the doctors or reviewed. If we can do that, then we should be walking the talk. Let us remember this day as the day when we started to walk the talk. We still have so many cases of maternal death coming from preeclampsia. We want to commit this afternoon that we are going to converge here, probably next year. We are going to converge here for PPH, but we want to commit that we are going to reduce all these preventable causes of maternal mortality to almost 0. Government is committed to ensuring that you get the supplies that you need. There has been a big problem, and I want to apologize on behalf of National Medical Stores. I think we disorganized their rhythm, but beginning next financial year, we have an assurance that all the supplies will be coming on schedule. This June, they will have delivered all the schedules 100%. Has Masaka got there? I don't know. DHO? Are you 100%? I've gotten a brief that you've received all your supplies 100%. That is on 6 cycles. And beginning next financial year, so Dr. Senyo, there's nothing like there are no supplies. Another development that we brought in board is that tranexamic acid will be available at health center 3s. Not only 4s, but up to health center 3s, where a birth is happening. Another development, next year we are introducing heat-stable carbetocin as part of the prevention of PPH, especially in areas where the cold chain is very difficult to maintain. But we shall supply to all facilities, and that is with support from the government of Uganda. So as we move away from here, I want to appreciate in a special way BAMA. BAMA, Dr. Eleanor, this lady is not appreciated so much. Can we clap for her? Eleanor, stand up. Eleanor, the reason we appreciate some unsung heroes is because we need to keep them moving. They get tired. They really get tired. Delivering MCH packages is one of the most tiring, but also very gratifying engagement. It's very gratifying, but very tiring. Thank you, Eleanor. Thank you, Team BAMA. Team BAMA, wherever you are, we clap for Team BAMA. Of course, Gan Murokora sometimes is BAMA, sometimes is Omewesh, I don't know where I belong. We want to clap for our DHOs. DHOs in the greater Masaka area. In this area, there is cooperation that does not exist in most of the regions in Uganda. The collaboration in Greater Masaka is very unique, and let's clap for them, ADHOs and DHOs. And Please continue with that. But I also want to stand with you as you deliver your mandates. Please, if there's anything that's challenging, get in touch with us. Your ambulance is staff at Ministry of Health. You don't need to come. Call me. You don't need to drive your fuel unless you have other business. But call us. We shall move. If you need an emergency commissioner, I'm telling you, they are not doing you a favor. They are supposed to answer your questions. We are supposed to make that link. No one is doing you a favor. Even if it's DG, he's supposed to attend these meetings of yours. So I want you to use us because we have these responsibilities to help you.